is Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The We Do Radio Network, WAGR in Lumberton, WYDU in Red Springs, and WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
Thank you so much, Ray. Welcome back to another episode of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. February is here. That means it's Heart Month. So we're going to talk about how to take care of your heart and what to do in case of an emergency. Now, one thing before we get started, because of what we're going to be discussing today, what I need you to do is remember that this broadcast is not a time for you to self-diagnose. This program is for informational purposes only. And if you or a loved one, you find yourself suffering from anything that we may discuss today, what I want you to do is find yourself a healthcare professional. Now, our guest today, he's been here before, ladies and gentlemen, Mr. Ben Beeson. Mr. Beeson, he is the patient care manager for cardiac services for Cape Fear Valley Health. Ben, welcome back to the broadcast.
Thank you for having me, Omega.
Now, first, Ben, before we get started, younger people think that this is an older person's problem. And when is the right age that we need to start being concerned about our heart health?
So I would tell somebody earlier the better, but it's really as soon as you can. It really is as soon as you can. Especially the way society is now, where we're a lot more sedentary. We tend to just sit around and watch TV. Even kids nowadays, they don't get out as much. All of that builds up. I mean, back in the day, you were busy until you were older, and then things caught up with you. But nowadays, you're not busy. It starts early, and we are seeing that when it comes to obesity rates and heart issues. It's creeping down, and that just means the earlier you can get started with it, the better your chances are to survive it later in life.
Diet and exercise. I preach this all the time because of my heart issues. When do people really need to start thinking about what they're eating, how they're exercising, and having that heart healthy lifestyle? Would you say the sooner the better in that case also?
Definitely the sooner the better, but I would say with exercise, it's something that you shouldn't stop. Remember how energetic you were when you were younger and you could bounce off the walls and everything. Of course, we get busy. We have to grow up and have a job and have a family and all that, but you need to stay active. It is one of the most important things you can do. Diet is a key factor, and I would say listen to how your body reacts to things. So if you eat that cheeseburger and 30 minutes later you feel horrible, that's probably a sign that you probably shouldn't eat that cheeseburger. I mean, all that stuff does catch up with you. If you do have to have that, then do it in moderation. Do it every once in a while. Make it a treat. Make it something special. Once you make it an everyday meal, you're going to suffer from it. Yeah.
And I did that. 30 years, you might as well say, fast food 3, 4, 5 times a day. Mm-hmm. The fast food places were right around the corner from the radio stations. And it would be... you get this going in, then you get off the air, you go back to the fast food place, you get that, then you're working late, then you go back another time, and then you've got to hit it on the way home because you're not going to be cooking.
Yeah.
But what happened with me was because I was born with a heart issue, I ended up being diagnosed with coronary artery disease.
Right.
And that is something that people need to be aware of because, Ben, I had no idea this was going on.
Yeah. So you have to, right now we're all worried about how fast we can get to do nothing. So we rush and rush to get to where we're sitting still. And we're so busy. And all of that is counterproductive for your heart. You need to slow down your hurry, but you also need to make sure you have the time to to work out, to walk, to do the little things that you normally would have to do. We are absolutely in a rush to hurry up and get in that seat, and we need to break that.
All right. Ladies and gentlemen, Mr. Ben Beeson is with us today. He is the patient care manager at Cardiac Services for Cape Fear Valley Health. Now, if you want to join this conversation, you can do it. What you can do is you can either call WIDU at 910-486-3111. Miss Glenda is at the desk. Amazing lady. She will pick up the phone. Or if you're following our live stream, you can leave the question or the comment in the comment section. Lindsay is taking care of that, and she will get the question answered or get the question to us if she can already answer it herself. And another thing I want you to do is make sure you share the broadcast. We're going to share a lot of valuable information. We're going to talk about a lot of important stuff and during this broadcast, and it's not going to be a time for you to recall. So just share the broadcast. That way all of the information is there, and then you don't have to be that middle person. Now, Mr. Ben Beeson is our guest today, and he is the patient care manager at Cardiac Services for Cape Fear Valley Health. Now, Ben, one thing, let's talk about the uncontrollable factors. What uncontrollable factors can increase a person's risk for heart problems?
So obviously age, you can't control your age. Gender plays a role in it. Race plays a role in it. What I would say is be cognitive of the issues that may stem from that. So typically younger people tend to have the higher metabolism. They're a lot less likely to have the heart disease. Mm-hmm. Can they still have the beginning of it? Yeah, they can still work towards it. It definitely plays a role, but they're not going to suffer from a lot of the side effects of it from an early age. And then let's say gender in there. As a lady, when you your hormones start changing as you get older, that plays a factor in there too, as your metabolism changes and your mobility changes and all of that. So those are things you can't control, but you also can prepare for them. So to expect that. That's the good thing about knowing what you can't control, is you can still prepare for it in the future.
Now, you did mention earlier about some of the factors that we can control, like diet and exercise. What kinds of things are there any other things that a person can do to lower their risk of developing or getting heart disease?
So get checked. Absolutely get to the doctor early. You should, as you get older, progressively go to the doctor more. You're more likely to have these effects that get to you, and you're also more likely to have symptoms come up. Don't be afraid to go to the doctor and get checked. The worst you can do is go and nothing be wrong with you. That's great, but if you didn't go and something was wrong with you, it may cascade into worsening conditions. And then by the time you do go, it's too late. You're suffering from multiple issues rather than just one. So don't be afraid to go to the doctor. Don't be afraid to ask questions. Be nosy about your health. Try to find out what's going on with you. If you have any concern, get checked.
I like what you said. Be nosy about your
Absolutely.
health. I like that. Now, Ben, let's talk about the basic things. When you compare all of the basic things, what would be the most important thing that people need to start with?
So if you think of like diet, exercise, or bad habits like smoking, I would say the most important thing to start with is the one that you can do the easiest. Only because you don't want to get yourself in a position where you're failing. You want to get where you're succeeding. So if smoking is hard for you to break, I understand that. It's not a good habit to have, but then try to walk. If you can't walk and you can't break the cigarette, then try to diet. And I would say, find the one that's the easiest for you to do first. Mm-hmm. Start getting yourself in that mindset of being healthy. Start getting yourself comfortable with change. If you go and try to change everything all at the same time, you're not going to be happy. You're not. There's a reason you have those habits. There's a reason you do those things. So change and let yourself start to feel better, and then let that feeling progress you to the next level.
Ladies and gentlemen, in the studio, Mr. Ben Beeson. He's our guest today on Cape Fear Valley Health's Making Rounds Live. He is a patient care manager at Cardiac Services for Cape Fear Valley Health. Now, Ms. Glenda sent me the correct telephone number. The telephone number for WIDU is 910-483-6111. I knew that. I just had brain block. But anyway, if you want to join the conversation, you can do that. You can call 910-483-6111. Or if you're following the live stream, leave the question in the comment section, and Lindsay will make sure that we get that question and those questions answered. Now, Ben, are there, you mentioned about gender. Are women or men more likely to have heart issues?
So that's a good question. And studies go both ways. And typically what you will find is that earlier in men's lives, they tend to have heart issues. Later in women's lives, they tend to have heart issues. And I think it stems from a lot of different society norms and cultural changes that we have, but really it comes down to genetic differences. I mean, women typically have a higher fat percentage, so there's a cholesterol issue that may play into that. Also, men tend to be more active younger, and you would think that would benefit them, but they also tend to get injured or have reasons to go see the doctor. And their symptoms tend to be more normal for reasons to get checked for your heart, whereas women tend to be a little different. Their symptoms may be milder, or they may be completely off the wall from what you would expect to be for a heart issue. And so they don't get checked for that reason. It's something they pass by. So I think society and culture plays a lot into that, but generally speaking, they would say women tend to have more heart disease issues, especially later on in life. So
now, the reason why I asked that question was because back when Darvin was still alive, we both were in the hospital at the same time. He would be in the hospital in the heart center, then I would be in the hospital in the heart center, then he would be, and then I would be. And the way that whole thing started was because he was having a procedure that day. And I talked to the cardiologist, and I was telling the cardiologist, I'm having really bad heartburn. And it's to the point to where it's raw, and I feel it, and I'm tired. But I figure, at that time, Ben, I was weighing about 204 during that time. And so I honestly thought it was because I was overworked and I was overweight. But Dr. Edger was like, let's schedule a stress test. And then comes to find out, after we did the cath, I had 95% blockage on my main artery.
right.
And my symptoms weren't anything like the heaviness in the chest and the tightness in the jaw. I didn't have any of that.
Yeah.
So
For women, it can vary greatly. Men tend to have the easier, the more recognizable signs of heart issues, the chest pain, the sharpness or the fatigue. But for women, it can be back pain. It can be jaw pain. It can be arm pain. It could be right side. I mean, like you said, it could be heartburn. I would just say if it's not something you can explain, then get checked. If you went and lifted something heavy and the next day your chest is sore, that might make sense. But if you didn't, if you were sitting around and the next day your chest is sore and you can't explain why, you should get checked. You should. The earlier you get checked, the more likely you are to be taken care of and survive whatever issue you might have.
now, Ben, I've heard doctors explain heart issues. They fall into two different categories. And it was strange when I first heard it, but they broke it down into plumbing and electricity.
Yep.
And can you explain to our listeners what this means, and could you give some examples?
Sure. So it definitely does have two main categories. You have the electrical side, which is causing your heart to contract, causing you to actually have the pump. And then you have the plumbing side, which is the oxygen circulating in your heart, the blood actually circulating. And they both can affect your heart in different ways. So when you think of plumbing, you're thinking blockage, you're thinking heart attack. You're thinking somewhere along the way, the flow was supposed to be working, and for whatever reason, either the hose is torn and so the water's leaking out, so you're losing the pressure, or something's in there clogging it up. So plumbing wise would be something along the lines of a heart attack or a heart blockage, where you start to feel fatigue, like you were saying. Yeah, it's building up, things aren't flowing like they're supposed to, and there's something that needs to be checked. From an electrical side, your heart actually has a pathway that the electricity follows to cause it to contract a certain way. And almost like your plumbing, the electrical pathway can get blocked. I mean, if you have a damaged electrical cord, you're not going to get the conduction you think you need. And so that would be along the lines of someone needing a pacemaker, something to stimulate that heart tissue to contract like it's supposed to. So those are the really big difference between electrical and plumbing. The key thing to know is, from like a heart attack, with plumbing, eventually, if you don't take care of it, that blockage will lead to damage in your heart, and that damage affects the electrical system. Every heart attack leads to an electrical failure of the heart. It just eventually will if you don't take care of it.
So it is true, your heart can short circuit.
Absolutely. You see that in sports games. You see that in when these young kids are out there playing and they get hit, like in football, and their heart stops. It's just the electrical system gets hit at just the right time. It causes it to go to an abnormal heart rhythm, and that's why they collapse. So yeah, it can be something that can affect you at any age. Plumbing wise, it's usually something that builds up over time. Electrical wise, it could be anything that can hit you. You really just have to, if you really just understand the difference between the two, you can see what risk you need to worry about at different ages in life.
Let's talk about the early warning signs.
Okay.
Are there any early warning signs of the symptoms? Because like I said, in my case, I had no idea that was what was going on. I honestly thought it was because I was fat. I honestly did. And, but that wasn't the case. It was the heart. So what are some of the symptoms of the early warning signs?
Absolutely. So the scary thing about heart symptoms or symptoms of like a heart attack or a blockage is that they can mimic so many other things. The good news is about half of those heart attacks or half of those symptoms start about a week before the actual heart attack. And that can be anything from fatigue. It can be heartburn. It can be nausea. It can be pain in your jaw, pain in your arm, pain in your chest. It can be dizziness. That's why I really push it that if you can't explain it, if you didn't start a new medication and that's why you're dizzy, if you can't explain why you're having these symptoms, you get checked. Like I said, half the time they start a week ahead of time. And if you can get in early enough, you can prevent any damage. You just have to get checked. Most people put it off because it's a hassle going to get checked. It is. But it could be the thing that keeps you who you are. It could be the thing that saves your life.
Yeah.
So,
ladies and gentlemen, Mr. Ben Beeson, he is our guest today on Cape Fear Valley Health's Making Rounds Live. And he is a patient care manager at Cardiac Services for Cape Fear Valley Health. As you know, February is Heart Month. That's the reason why we're discussing this today. Now, Ben, what would you recommend our listeners to do if any of these symptoms that we've discussed today sounds familiar?
As soon as you recognize you have a symptom you can't explain, you need to get checked. You need to go to your doctor. If you can't get in to see them that week, go to urgent care. I hate to tell you to go to the emergency room, but if you can't explain it, go to the emergency room. Go there and be wrong. Be wrong about it. At least get checked. I think there's a lot of people that it becomes a hassle because we're so busy in life nowadays. It really is. It messes you up. It messes with your week. But it could be the difference between you surviving. And it could be the difference between the rest of your life. If a lot of heart attacks are survivable regardless. But once you have the heart attack, that muscle is damaged. It's not going to come back. Your life is affected from then on. Don't take the time later on take it now and get yourself checked. If you can't get in the doctor, go to urgent care. If you can't get to urgent care, go to the ED. Absolutely. Don't wait until the last minute to rush yourself in.
Now, one thing I want you to repeat. Once that muscle is damaged, it cannot repair itself. Is that what you said?
That's right. That's right. Have you ever slept, well, I won't say slept wrong. Have you ever had your foot go to sleep because you were sitting funny? Mm-hmm. Okay. Imagine that's your heart. You sit funny, you cut off that circulation, right? Your heart starts to go to sleep. Part of it starts to get damaged. If you fix your foot, you feel that you have the feeling come back, right? Mm-hmm. So if we can get that heart fixed early enough, that feeling will come back. Everything will work like it's supposed to. We can fix that. If not, if you were to block that off long enough, you get that permanent damage. You never get that feeling back. You never get that flow back like you're supposed to. So in the same way, if you can feel, you know how fast it is your foot can go to sleep, your heart can get damaged that quickly.
Wow.
We have metrics for the hospital where we try to get you in and get your heart opened up in 90 minutes. And that's because we're trying to prevent permanent damage. And the earlier we can get you in there, the more likely we can get you to prevent that permanent damage and you go back to having a normal life.
You mentioned the urgent symptoms. What are the emergency level symptoms, or as I would call the 911 symptoms, that people need to be aware of and you really and truly shouldn't sleep on?
Yeah, there's I will tell you, you can almost guess those for yourself. You know your body. Mm-hmm. If you don't feel right, if you really just don't feel right, you should get checked. You should call 911. If all of a sudden you're fatigued and you just don't know why you can't catch your breath, you don't know why you can't get up and move, you don't know why you can not be dizzy, you need to call 911. The worst thing you can do is not and pass out or go into a cardiac arrest, especially if you're by yourself. Then there's nobody coming for you. So yeah, if you feel dizzy, if you feel awful, get checked. Absolutely, call 911. Let them at least get there and check you out. Even if you decide, hey, I don't want to go to the hospital now, at least let them come and check, see what's wrong with you.
Let's talk about treatment. A person, they haven't had a heart attack, but they have a diagnosis of a heart problem. Is that going to end up in surgery for the person?
So not necessarily. It really does depend on the heart problem they have. There are a lot of preventative measures, a lot of medications that help alleviate the heart issues that somebody may have. There are conditions that are almost guaranteed surgery later on in life. That's just how it is. The great thing is that if you know about them early, you can prepare for what to expect, and you can be ready for when that time does come. Preparation is probably the biggest thing you can do. Know about your body. Like I said, be nosy about your health. Know what's going on. You don't want to wait till you're 50 or 60 to find out you have a heart problem. If you could have found out when you were 20 or you were 30 and started preparing for what to expect. I know I have a heart problem. I know in 20 or 30 years I'm going to have to get a procedure to replace a heart valve. I know all about that now. I know what to expect. I know what symptoms I need to watch for. So I'm in a better position to make sure when that time comes that I'm good to go. And that's what I would encourage everybody else to do, the same thing. It's not just because you have a heart problem doesn't mean you're going to have heart surgery, but it means that you need to be prepared for what might happen in the future. And the earlier you can get prepared, the earlier you can start taking care of yourself and be ready for it, the higher likelihood of you having a normal, high-functioning life.
Ladies and gentlemen, we're having an amazing conversation with Mr. Ben Beeson. February is Heart Month. We're discussing the heart today. And Ben is here because he is the patient care manager for cardiac services for Cape Fear Valley Health. And he's been on the broadcast before. And he does the hands-only CPR demonstrations out in the community. So that is the reason why we have him on the broadcast today. He's an expert in the field. So, Ben, what are the different types of surgical procedures that a doctor might recommend? Now, I know one is a cardiac cath,
right?
Because I have about 3 of them. So what are some of the other procedures?
So it really depends on what your heart issue is. Obviously, if there's a blockage or a heart attack, they're going to do a heart cath, and that's, the roto-rooting, going in and cleaning out that vessel and opening it back up so that the plumbing's working like it's supposed to. And then there's things like electrical system where they get a pacemaker where they're going to, actually stimulate your heart to beat. There's, in my case, valve repair where they're going to go in kind of like a heart cath and put in a fake valve. And it's an outpatient procedure now. There's open heart surgery for patients that have to have it. So if your vessel's, too blocked and they just can't go in and clean it out without risking your life, you may have to have open heart surgery, and they may have to put a new vessel in there for you. It really does vary greatly. But once you find out what issues you have, look into it, and don't be afraid of it. Be afraid of it. They wouldn't do it if they were worried it wasn't going to be good for you. You want to do the things that are going to help keep you who you are for the longest you can. So don't be afraid to go in and find out about yourself, and don't be afraid to find out that you have a problem. The earlier the better. Get it taken care of.
Now, one thing you did mention, now I know a cardiac cath is outpatient. Valve replacement you said was outpatient. So it sounds like the majority of the procedures are outpatient procedures.
With technology nowadays, absolutely. Some of those things 10 years ago, no, you would be in the hospital for days. But now it's so fast, it's so safe. Everything is getting so much better as technology moves on. There are actually pacemakers now the size of like a AAA battery.
Really?
Yes, and very close to getting to where you can actually get a pacemaker put up like a heart cath and just go in and screw it up right there where it needs to be. It's wild the way technology is, but it is definitely growing. And I'm going to tell you, don't wait till technology catches up. Get checked out, but know that it's really amazing the things that are happening now, and safer than it's ever been. So get yourself checked out early, and then find out about it. It's amazing what we can do now. So.
I'm still stuck on the pacemakers like a watch battery. I'm still stuck on that, Ben. Now, Ben, if some folks don't learn that they have a heart problem until they have a heart attack, what I want to be very clear about this. I want our listeners and our viewers to get this. What are the odds of surviving a heart attack if a person is not already at the hospital?
So the faster you can get somebody there and get you to the hospital, the higher your odds get. To be honest, most people survive heart attacks. Most of them do. It can be even in the high 90s, to be honest. The problem is your heart gets damaged, and then you're not the same person you were. And that really is the kicker. Can a heart attack kill you? Absolutely, it does all the time. Generally speaking, especially if you were to get early intervention, you're 98, 99% likely to survive.
Wow.
The real key is to prevent or reduce the damage that happens to your heart. The longer you take to get it fixed, to open that blockage up, the more damage there's going to be until that whole section of your heart dies. So even outside of the hospital, if you can recognize the symptoms and you can get on your way, the odds of surviving are very, very high. It's the people that don't go or are too afraid to go, and then they damage themselves. And when that happens, your likelihood of having another heart attack or more heart problems becomes exponentially higher. So you really do reduce your life by not getting checked, whether it be the length or the quality.
Ladies and gentlemen, Mr. Ben Beeson is our guest today on Cape Fear Valley Health's Making Rounds Live. As we recognize February as Heart Month, and that's the reason why we have Ben on the broadcast today. Now, Ben, if you're with someone who may be having a heart attack, right after you call 911, because I'm going to freak out. So call 911. What is the next thing a person needs to do?
Most people do freak out more than the person that's actually having the issue, to be honest. So the most important thing you can do is keep them calm. If you have to freak out, that's fine, but you need to keep them calm. You don't want them to overexert themselves at all. So if they can lie down, be flat, take slow, deep breaths, anything to improve the demand your heart has and the amount of oxygen you can get to your heart. Because that's what's killing them, the lack of oxygen, the blocking of the oxygen flow into the heart. So you want them to really find a way to relax and just wait out the ambulance coming. You don't want them up packing stuff. You don't want them moving around. They need to lie down. They need to be still. They need to take slow, deep breaths. Let you do all the panicking for them. Let them relax as much as possible. The more demand you have on the heart, the more oxygen you're going to use up, the less likelihood you are of actually having survivability, or more likelihood you are of having damage. When your heart is struggling, you want it to do the least it has to do. So you, as hard as it sounds, you want them to relax.
Well, Ben, what if you're by yourself?
Same thing. Call 911, put it on speakerphone, lay down. Lay down somewhere that's open. Don't go to your bedroom and lie down.
Excuse me.
If you need to lay down on the couch in the living room, lay on the floor somewhere, make sure your door is unlocked. Make it easy for people to get to you. You want to prepare for them to be able to come in nice and smooth and get you out as quickly as possible. So don't go hide in the bathroom. Don't lay in your bed. Go somewhere that's the most public you can, and that's where you need to lay down.
All right. Now, Ben, you teach hands-only CPR course for the community, and you do this pretty much for anyone who is interested. Now, can you tell us a little bit about that? How long it is? How do people sign up?
Sure. So absolutely reach out to me. My number is 910-615-8294. That's my office number. Just give me a call. We'll set up for you to come out, or for us to come out to see you, or for you to come to us, either way. It is 100% free to have the hands-on CPR training. I can teach you in 15 to 30 minutes if it's just you. If you have a group, 30 minutes to an hour. But I would say learn it. It's easier than it has ever been. It's more fun than it's ever been. It's not the certification course, but I will guarantee you will remember just as much, if not more, and you will have more fun doing it. And that really is the key. We want people to understand it's a scary situation when things happen, but you don't have to be scared. You don't have to. And the more calm you are with learning and understanding, the more likely you are to get involved when somebody does have a cardiac arrest, and the more likely you are to save their life. So we really are trying to make trying to turn around the stereotypes, or the horrible things that people think about it.
The stigma behind it.
Yeah, the stigma, right, there you go. And change that so that people get involved and help save their neighbors, save their friends in the community.
Now, I'm glad you mentioned the stigma. I remember when you first introduced hands-only CPR, and I was talking to someone who basically feels that they know everything about the medical world. And they were telling me, no, hands-only CPR does not do the same thing that CPR does. And I'm like, yes, it does, because I interviewed the man today. So is hands-only CPR, is it the same as, does it do the same thing?
Outside of the hospital setting, absolutely.
Okay.
Absolutely does. And the key thing is you don't practice. You don't practice doing mouth to mouth. You don't practice tilting the head back the right way. And so when you're doing those things incorrectly, you are actually causing more time to elapse when you could have been circulating the oxygen that's already in somebody's system. And that really is the key. You go and you learn the 4-hour certification course and you have that certificate, but that's not the end of it. If you don't practice, you're not going to remember what to do. And I know you can go back every 2 years and get recertified, but 2 years is a long time. And if you don't do it, just from experience, from what I see in the hospital system, from what I see for other healthcare professionals, if you don't practice, you lose it. You really do. But on top of that, there's enough oxygen in your system for about 10 minutes to keep you alive. It's just not circulating. The body's very much a pressurized system. So as you're pushing down with compressions, you're still moving the lungs. You're still getting some airflow in and out. It absolutely makes a difference. Don't waste time doing things you don't practice. Do the simple thing that you can do, push on that chest hard and fast. You're still 2 to 3 times more likely to help save their life. So even if you've never learned, anything is better than nothing. But particularly with mouth to mouth, if you don't practice that, which you may have a cute loved one at home, maybe you do practice mouth to mouth all the time, but if you don't practice it enough, you're not going to be good at it. You're not going to open up the lungs. You're going to be pushing that air into the stomach, and that just makes it that much worse.
Wow.
So skip that. Do the chest compressions. Call 911, do the chest compressions.
Awesome. Now, Ben, before we close out today's broadcast, is there anything that we haven't touched on? Is there anything that you want to stress to our listeners and our viewers before we let you go?
Just definitely be nosy about your health.
I'm going to take that term, Ben.
Please do. Please be nosy about your health, okay? You know yourself more than anybody else. You know when you're aching, when you don't feel good. And if it's not something you're used to, if you can't explain it, find a way to explain it. You need to have that information. Don't sit there and be like, oh, it's going to be okay. No, if you don't know, figure it out. You need to find out why. Knowing yourself is what's going to keep you alive. It's going to keep you motivated to exercise. It's going to keep you motivated to eat healthier. You know, if you don't know what's going on, so there's no reason for you to have to eat healthy. But if you know what's going on, and if you know eating healthy can make a difference, you're much more likely to do that. You're much more likely to stop smoking if you know that your vessels have plaque already in there and you're at risk for a heart attack. You know, if you don't know that, what's gonna encourage you to stop?
Exactly.
So know yourself. That's the biggest thing you can do.
The Good Samaritan rule.
Yeah.
Say what?
Can you go over the Good
So-
Samaritan rule?
Sure. So one question that came up was about the Good Samaritan law.
Okay.
And essentially what it means is if somebody has collapsed and you're doing chest compressions or you're doing something to try to save them, you're protected from being sued if you hurt them. A lot of cases when you're doing chest compressions, you break ribs. You really do. You have to push hard and fast, and you're trying to save somebody. You want effort put into that. And some people are afraid that if they put those hands on and try to help that person, that they're going to get sued if that person comes back. And you're protected. If your goal or what you're doing is actually designed to help them, whether you do it incorrectly or not, if you're trying to help them, and that is your intent, you're protected. And we want people to realize that. Don't be afraid to put hands on. Yeah, it's a stranger. You don't know them. They might wake up angry at you, but at least they wake up. And know that you're protected, that if you do hurt them, they might wake up sore. Okay, but they woke up. So don't be afraid to put your hands on and actually try to save them.
Ladies and gentlemen, on that note, Mr. Ben Beeson. He has been our guest today on Cape Fear Valley Health's Making Rounds Live, and Ben is the patient care manager in cardiac services for Cape Fear Valley Health. And you always hear me talk about the cardiac department over there. Amazing people over there. Ben, thank you so much for being with us today. Thank you for taking time out of your busy schedule to come and talk with us today.
It's always my pleasure, and I'm sure I will see you again.
Oh, you will. Oh, you will. Well, ladies and gentlemen, don't forget that our next broadcast is Tuesday, February 25th. And we're going to talk about a new volunteer program at Cape Fear Valley Health. It's called the No One Dies Alone program, and is aimed at patients without family members at their bedside during their final moments. Amazing program, excited to talk about this. And we're going to have the program's coordinator, nurse educator Rachel Thurner. She will be with us to discuss this and talk about the program. So like I said, make sure you join us and get some questions ready for the lady. So for our producers, Shaka Jordan, Ray Thomas, and Lindsey Graham, and the hardworking team behind the scenes, I'm Omega Jones, continuing the legacy of Darvin Jones. Thanks for listening and watching Cape Fear Valley Health's Making Rounds Live.